We are going to go right into our talk with Dr. Ming Lynn, who, felt that responsibility to patients and colleagues to speak out, and was retaliated against for that, being fired by both Team Health and Peace Health. So he's going to speak for about 15 minutes. He's currently in actually a lawsuit backed by the ACLU. And with great pleasure, we'll introduce Dr. Ming Lin.
Hi, let me get set up over here. Mitch, thank you very much for my invitation, and a lot of respect to you guys and Dr. McNamara for organizing all this. I'm going to share my screen right now. And here. Share screen. Oh, how come it's not sharing? Yes. Oh. Can you guys, no, you guys can't see this? No?
We see it.
Was it?
They can see.
Can you see the my screen, the corporate medicine and silencing of healthcare workers?
Yes.
Okay. All right, Shishina, I gotta put a view. I was gonna silence. Okay. Snap. All right. Sorry, I'm not as high tech as Mitch over there. Anyway, I'm gonna take my face off because I don't want to distract from this presentation. Anyway, my name is Dr. Lynn. I've been an emergency physician for about 30 years. And it's a specialty I absolutely fell in love with as a medical student. I just love the challenge, the excitement and uncertainties of our patient. But what I love the most is that we treated every one of our patients equally and to the best of our ability, no matter what their financial status was. Today, I'm going to talk about something that I feel very passionate about, something I've experienced, and basically it's about how our voice as healthcare workers is silenced by the corporate world. Next. Most of you probably know me as the emergency physician whistleblower who is suing, along with the ACLU, 2 large medical corporations. I basically called out my hospital for not doing enough to protect its patients and its staff on social media, and as a result was terminated by my 2 employers. One being a multi-corporate hospital group, which has somewhat of a monopoly in the Northwest region where I live. And the other one, a large, well-known private equity-owned company that employs emergency physicians. Because my case is under litigation, I made a slide for my lawyers, who quivers every time I open my big mouth. What I realized from my whole experience as a whistleblower is that being reprimanded for or fired for speaking out is not something new in the healthcare field. I was not the only one. Healthcare workers have been afraid to speak out for patient and staff safety for a very long time. The whole pandemic just made it visible to the public and to the media. Perhaps the most well-known whistleblower in this pandemic is Dr. Wing Li of Wuhan, China. He sent out a message on social media to a small group of his friends, warning them of a potentially deadly respiratory virus. Within 4 days, he was called in by authorities and told to retract his statement and apologize for spreading unwarranted fear. He was denounced publicly by the media as a rumor monger. They actually broadcasted his apology on television as a doctor causing unnecessary panic. Now, Dr. Li lives in a country that's well known for censoring and monitoring the internet. Free speech is suppressed. People have to be careful what they say or they may be punished. But Dr. Li was not the only one. There were 8 others who were called out and punished for sharing their concerns. Dr. Li eventually succumbed Like Dr. Lee, they succumbed to their fears and publicly apologized for spreading and causing unwarranted panic. Dr. Lee received worldwide recognition when he caught COVID and eventually died from it at the age of 34. So is our ability to practice medicine as healthcare workers under corporate medicine any different than Dr. Lee's experience? Do we also fear speaking out for the safety of our colleagues and patients? The atmosphere we work in is becoming increasingly corporate. Are the companies we work for any different than Amazon and Microsoft, whose primary objective is profit? Today, less than 5% of America's 6,500 hospitals are run by chief executives with medical training. So how do you control physicians? You control them by controlling the medical staff. It is the job of the medical staff to credential physicians and determine if they are physically, mentally, or morally competent to practice medicine at the hospital. At any point, the medical staff can revoke the physician's privilege. Hospitals over the last few decades are competing to control the medical staff and strip them of their independence. With the medical staff as pawns, hospitals can manipulate physicians to do what they want. If you want to keep working and pay off your $500,000 student loan or mortgage, or a yacht, if you're an orthopedic surgeon, you better listen to the medical staff. I used to think human resource was a place you can go to protect us against discrimination, harassment, or simply expressing your concern about management. But who runs human resource? Who pays their salary? Here in a poll taken among employees, most actually think human resource is looking out for the employers, not the employees. In another poll, more than half of the employees stated that they would not report discrimination to human resource. The major reason being that they have witnessed retaliation among their fellow coworkers. When dictators seize a country, the first thing they do is take over the media. Our media companies, whether it be Fox or CNN, are increasingly being influenced politically and financially. Local newspapers are not an exception to this, as they may often rely on the financial support of the largest business in town, the corporate hospital. Here, an original article from the Seattle Times is reprinted by the local paper with a totally different title, giving it a totally different meaning. One word is also omitted from the local newspaper, the word whistleblower. Oh, yeah. So Dr. Lee was labeled as a rumor monger by the government-controlled media. But to what extent will corporate hospitals go to discredit a whistleblower? Here in front of over 1 million potential viewers on a popular web video, Z-Dog, an administrator for a corporate hospital goes public and calls the whistleblower scared and for
effectively yelling fire in the theater. Effectively yelling fire in the theater. Effectively yelling fire in the theater.
He is calling this pandemic a fire that has killed more American soldiers than World War I, World War II, and Korean War and the Vietnam War put together. A fire that recently surpassed the number of Americans dying from the 1918 pandemic. This is where it gets creepy. There is no US law prohibiting corporations from monitoring the social media pages of their employees. Even if the social media page was done and posted inside your own home, on your own personal device, on your own free time. According to labor union officials, actively monitoring the social media page of the employees is common in corporate medicine. It took the Chinese officials 4 days to hunt down Dr. Li. Healthcare whistleblowers in this country have been approached by the supervisor in less than 48 hours. I guess corporate medicine is just a little bit more efficient than the Chinese government.
Dr. Lynn, I think somehow you might have gotten muted. Dr. Lynn, I think you somehow got muted. It's probably Team Health or Communist China.
Should I just pick up here?
If you go back one screen, I think that's where we left off.
Let's go back one screen. Should have to go back one screen.
Or this is fine to start here.
All right, I'll just start over here. So where is our, where is ACEP? ACEP is our, okay. So ACEP is our largest advocacy group for emergency physician. And advocacy usually means showing public support. Yet ACEP has been incredibly silent. The story of an emergency physician, along with ACLU suing a well-known employer of emergency physicians, is told in the New York Times, LA Times, NPR, The Guardian, et cetera, along with many other worldwide media sources. Yet it receives not even a mention on its newsletter, not a single word. ACEP did initially come out with this statement when an emergency physician was fired for speaking out for safety during the pandemic. The statement basically reads that they are aware of the termination of emergency physician, they will reach out to them. However, this statement has mysteriously disappeared from their website. This is my favorite slide. ED directors of the past were one of the strongest advocates for the safety of our patients. They advocate for policies we take for granted today, like prompt reading of a CT scan, consultation by a specialist. If they were unsafe to go, patients were admitted. Today, corporate medicine has changed everything. Now the ED directors that are hired by corporate medicines are merely pawns. They're paid not to look out for the safety of our patients, but instead they are assigned to maintain and secure the lucrative contract at all costs. So corporations are meant to generate maximum profit, and it's their nature to do so. And unfortunately, there are consequences. The corporate practice of medicine, to me, it's a bit like throwing a raccoon in a hen house. What I do know is that if we silence the healthcare workers, the outcome would be even more disastrous. Okay, thank you very much. Mitch, you can take over now.
Dr. Lynn, thank you so much for speaking out. You really are an inspiration. And I honestly think that for every person like you who actually does speak out or takes this to a lawsuit, for the right reasons, so many others, might settle early if they actually do take it to a lawsuit, and many others just won't speak out. And you actually standing up is going to inspire others, because it's not just simply an example made, but this is what we're fighting for. This is that due process. Deborah Fletcher asks if you ever heard anything else back from ASAP right before we switch to Dr. Patel.
I'm going to not comment on anything like that.
Fair enough. At this point, thank you so much, Dr. Lynn.